r/ask Reddit doctors of Reddit, what's the biggest case of faking it you've ever seen? Physical therapist here. Working mom comes into the clinic with her infant in a stroller. She's limping like she's got a nail in her foot. Wincing in pain and tears in her eyes. She's crying during her visit with the PT. None of us think she's faking it. She limped out of the clinic. I glanced out of the window and saw this woman bounding down the sidewalk. Hips swaying, full stride, going places. We were all fools. Not a doctor, but am a UK-based midwife. Had a patient who had been in and out of hospital throughout her pregnancy with episodes of heavy bleeding. This was her 6th baby, so she was a fairly well-known patient in our unit. The issue was no one had ever seen her actively bleeding. She'd call saying that she had bled down the toilet but flushed it, and all the examinations we did came back completely normal with mostly no evidence of any bleed whatsoever. On occasions during speculum examinations we'd see the smallest amount of blood. I was caring for her during a shift where she yet again called to say she was bleeding, walked into her room and found her jabbing around her vagina with a sharp object to make herself bleed. She had been doing it the entire pregnancy. The reason she gave, because she had 5 noisy children at home, needed some rest and knew we wouldn't admit her to hospital if it wasn't for a good reason. She would do it any time her being discharged home was mentioned. We ended up having to complete a perinatal mental health referral and consult with the safeguarding midwives as she was putting herself and baby at risk of serious harm. Edit. So this got a lot more attention than I ever expected. There's a lot of questions regarding birth control and questioning her parenting, so thought it best to add an edit. This patient was not by any means a benefits seeker. They were a hard-working and loving family that had full-time jobs. She had been booked in to have her tubes tied but found out a week before the procedure that she was pregnant with this baby. She just couldn't cope during the pregnancy, and became very mentally unwell. She did not realize the implications or understand the face that she was causing massive harm to herself and her baby. She was referred to our perinatal mental health team and treated for psychosis. They also had a lot of input after she had her baby. She ended up having a C-section and was sterilized at the same time at her request. By all accounts she is doing very well now. Also thank you very much for the slivers. Imagine being so exhausted with your family that you feel the need to stab yourself in the vagina. Yikes. I hope that woman found the help she needed. Obligatory, not a doctor, I'm a nurse. We had a guy who had to come in every 3 months to get a medical certificate to say he couldn't work at his retail job due to severe disabling back pain. He was receiving large amounts of insurance money for this condition. After the doctor had done his usual examination and questions and signed it off, the guy asks the doctor to check his shoulder, which doc does, and asks how he injured it. Guy says playing rugby for a competitive team. Really, says doc? How long have you been playing for them? Guy has been playing and training the whole time. Doc puts this info on insurance form. Doc loses his shit in staff room laughing. Next week the patient loses his shit in reception because his insurance has been cancelled. Ha. I used to know a guy who badly injured his back at work and got lifetime compensation. It really freed up a lot of time for him to train for cross-country ski races. I am a nurse but not a doctor. I had a patient who worked in a hospital, janitor, so he knew enough to fake a bit. He was seeking pain meds, complaining of chest pain, wanting morphine. He was worked up for everything cardiac and was fine. Then he tried to claim GI discomfort when he was being discharged. Cleared again for everything. Fake chest pain again. Cleared again. Now he's my patient. I'm a new face. He's telling me he's having abdominal pain. I call the doctor, knowing this guy's history. He says he'll be up to see him soon. This patient wants a ginger ale, some stomachache. I decide to go to lunch. My coworker comes into the lunchroom, disgusted. This guy had taken a dump in a basin and then dumped the ginger ale over it and tried to tell her he had fecal vomiting. He obviously needed Dilaudid right now for the pain. I walked into his room and sure enough, a pile of shit and a puddle of ginger ale. I told him I'd have to take away his food and drinks and we'd have to put an NG down. Suddenly he changed his tune. He admitted to faking it. Why do these people do what they do? In the story, opioids. Till about fecal vomiting. 4th year medical student. On my ER rotation and a trauma came in from a woman that had been arrested. During the drive the patient banged her head 4 times against the window of the police car and then went unresponsive. She came to us with a bruise over her forehead and unresponsive. We all smelled BS, but the patient was a great actor, didn't even flinch during the digital rectal exam, which is standard for all patients that come in through the trauma bay. though some of the nurses said that they caught her peeking at us when we'd leave the room. We ended up getting a CT scan, which was normal, and was even considering intubating her to secure her airway when our attending finally walked over to her, opened her eyelids and held them open while telling her to wake up. Finally she started fighting to close her eyes and the jig was up. The doctor called her out and she proceeded to start screaming at us. She was much more pleasant when she was pretending to have a brain injury. Why is a digital rectal exam standard for all trauma patients? Assessing for rectal tone can give insight into spinal cord/neurological injuries. Presence of blood in the rectum could indicate GI/pelvic trauma. Prisoner came in with signs and symptoms of a big stroke. At that time the protocol was to get a non-contrast head CT to rule out a bleed and then give TPA, a powerful clot-busting drug that's only worth the risk if the benefit is to mitigate a major stroke. So that's what happened. Later in the course he got a little carried away and started embellishing his story with symptoms that didn't make sense with his stroke diagnosis, and that's how we figured out he was faking it just to get some time away from jail. Not a doctor but worked in healthcare for nearly 20 years while taking a break from the ICU, due to it being emotionally draining. I worked in home health for a bit. I had a patient who clearly had Munchausen syndrome. On a daily basis she would call her insurance to see what things would be covered if she was diagnosed with this or that. She called her doctor's office an average of 5x during my shift with her. She would report all kinds of non-real symptoms. She pestered the doctors into do exploitive laparoscopic surgery. Of course nothing was found. One day I walked in and she was rubbing her incisions with rotten cabbage trying to get it infected. She wasn't seeking pain meds, except to sell. Really she was just as happy with antibiotics or stool softeners, anything, as long as they wrote her a prescription and she got to go to the pharmacy where she did a whole song and dance for them too, claiming allergies and reactions. She always increased the exaggeration of her story too. One time she fluttered her eyes, after making sure I was looking, and said she lost consciousness in that half a second. She called the doctor and claimed she lost consciousness for 5 minutes. She called the insurance and claimed it was 10 minutes. She called the pharmacy and claimed it was 30 minutes. Then she called 911 and told them she woke up on the floor after losing consciousness for 4 hours. The worst thing about her was she was a mom. Her son was 28 at the time, and by all the stories of his childhood illnesses and all her saying how he is severely disabled, I knew she basically fucked up his childhood with Munchausen by proxy. She portrayed him as being severely disabled and that's why he would never find a wife. I met him, he was healthy and of average intelligence. He wasn't looking for a wife, he was gay, but she refused to accept that. Working with her was so miserable that I took a couple years off from any and all healthcare after that. My mom was an emergency room nurse. Years ago they brought a prisoner from the local pen in who seemed to be unconscious. The guards were suspicious that he was faking it. They checked his vitals and everything seemed to be okay. The attending doctor tried poking him in the foot with something pointy, nothing. Then he got an idea. They took a rubber hose and inserted it in the back of his throat as if they were intubating him. That did the trick. He sat up very quickly, coughing and gagging. Edit? Yes, sternum rub, got it. Not a doctor but worked in healthcare for nearly 20 years while taking a break from the ICU, due to it being emotionally draining. I worked in home health for a bit. I had a patient who clearly had Munchausen syndrome. On a daily basis she would call her insurance to see what things would be covered if she was diagnosed with this or that. She called her doctor's office an average of 5x during my shift with her. She would report all kinds of non-real symptoms. She pestered the doctors into do exploitive laparoscopic surgery. Of course nothing was found. One day I walked in and she was rubbing her incisions with rotten cabbage trying to get it infected. She wasn't seeking pain meds, except to sell. Really she was just as happy with antibiotics or stool softeners, anything, as long as they wrote her a prescription and she got to go to the pharmacy where she did a whole song and dance for them too, claiming allergies and reactions. She always increased the exaggeration of her story too. One time she fluttered her eyes, after making sure I was looking, and said she lost consciousness in that half a second. She called the doctor and claimed she lost consciousness for 5 minutes. She called the insurance and claimed it was 10 minutes. She called the pharmacy and claimed it was 30 minutes. Then she called 911 and told them she woke up on the floor after losing consciousness for 4 hours. The worst thing about her was she was a mom. Her son was 28 at the time, and by all the stories of his childhood illnesses and all her saying how he is severely disabled, I knew she basically fucked up his childhood with Munchausen by proxy. She portrayed him as being severely disabled and that's why he would never find a wife. I met him, he was healthy and of average intelligence. He wasn't looking for a wife, he was gay, but she refused to accept that. Working with her was so miserable that I took a couple years off from any and all healthcare after that. I grew up the opposite way. I would get 3 to 4 migraines a week, but everyone thought I was faking it because most days I seemed fine, just because I was learning how to deal with them and try to act normal. It wasn't until 8 years after they started that I went to a neurologist who said I have chronic migraines, which I dealt with unmedicated for 16 years. Now I'm on medication. I feel like my childhood was wasted. Edit. I've replied to a lot of you nice people, but I'm on mobile and it will only load like 200 replies and I can't view any more to reply on, but I like reading your responses. Much love to you all. Was told this one by a fellow nurse I used to work with when we had a psych floor. It's not unusual for psych patients to stash things in various orifices. This one woman was convinced she was impregnated by a ghost-like figure but no one would believe her. So one day she started complaining of massive pelvic and uterine pain. She called them contractions. So the doctor goes to do an exam. The doctor feels something larger in there so they prep a table to get the object out, which was quite large. So the wonderful third year helping with the procedure starts hearing this woman complain of contractions and yelling things like, "Should I push? I'm gonna start pushing." Doctor trying to work forceps around this woman's parts as to not hurt her. Finally goes God. And as he starts saying it he pulls out a baby doll. Head only. The poor med student did the wobble. Went all flush, had problems keeping balance and about took a dive. I was told he didn't live that down the whole rotation. When I was a kid, I would plan my sick days way ahead of time. Had an old thermos that I would pour leftover milk, meat, whatever. Leave it on the windowsill in my bedroom just letting it fester for a month. Of course the thermos was closed so no smells escaped. I set an alarm for the middle of the night, dumped the contents of the thermos on my rug and ran in to tell my dad I was throwing up and so sick. However, this thermos monstrosity filled the entire condo up with horrible smells and both me and my dad ended up puking into the tub at the same time every time we tried to clean up the rug. He had to take the day off work too. Needless to say, I never pulled that again. Audiologist, hearing specialist, have worked in private sector with legal claims, and with the VA handling veterans' claims of hearing loss. With those two populations, having people faking hearing loss is pretty common. Now, as a professional, for me the hearing test starts when I call the person's name from the waiting room. In a normal voice I call them. If they answer I already know that they're normal/no worse than mild loss. This was the case with this guy. He answered and came in. We had a normal conversation. So, case history over, time to test. I give the instructions over the headphones at a reasonable 50 decibels. Decibel. Raise your hand when you hear the tone. 50 decibels tone, should be easy and clear, but he doesn't raise his hand. I go up. And up, and up. Finally, I'm putting a 100 decibels tone in his ear, he's flinching from pain, it's so loud, but he doesn't raise his hand to indicate he's heard the tone, even with re-instruction. I immediately know what I'm dealing with. I have taught entire classes on how to spot and try to get estimated true results from people trying to fake it. Long story short, I wrote a damning report outlining all his inconsistencies and faking behaviors. The thing that made this one so memorable, is that we had such a pleasant conversation before. He was a fire chief. I have firefighters in my family. It was one of those where you think if it wasn't for professional/patient appropriate distance, we could hang and be friends. But then, this guy was determined to get a disability rating, and it just pissed me off. I have other stories in case anyone is interested, but it's likely this comment gets buried.